In this session, we are going to discuss an important quality management topic called Handling Deviations, Errors, and CAPA, which stands for Corrective and Preventive Actions. In regulated industries such as pharmaceuticals, biotechnology, medical devices, and laboratories, deviations are unavoidable. However, how we find, investigate, and resolve those deviations determines the strength of our quality system. A small deviation may appear insignificantly initially, but if ignored, it can lead to quality failures, regulatory observations, product recalls, or even patient safety risk. In this session, we will understand what deviations are, how investigations should be conducted, how root causes are identified, and how effective CAPA systems help prevent. Every deviation, whether small or large, should be treated seriously. The first step is proper documentation and investigation. Whenever a deviation occurs, it must be formally recorded and evaluated for its impact on product quality, process performance, and patient safety. The second objective is preventing. Many organizations make the mistake of simply closing deviation records without addressing the underlying cause. Most importantly, effective deviation management protects patients. Unsolved deviations weaken the quality management system and increases risk to product integrity and regulatory compliance. Let us first understand what a deviation actually means. A deviation is any departure from approved procedures, specifications, protocols, or expected operating conditions. There are two main types. The first is a planned deviation. This is a pre-approved departure from a procedure, documented before execution and supported by proper approvals and controls. The second is unplanned deviation. This occurs unexpectedly during operations and requires immediate reporting and documentation. Whenever an unplanned deviation occurs, an investigation should begin immediately to assess its impact on product quality, batch disposition, and regulatory compliance. Timely action is critical because delays may result in loss of important evidence. Many people think deviation management ends when a CAPA form is completed. In reality, that is only the beginning. The true objective of CAPA is not documentation. The true objective is sustainable improvement. If a deviation is temporary and isolated, investigation and CAPA may be sufficient. However, when the deviation reveals a permanent weaknesses in the system, a formal change control process may also be required. The key message here is simple. CAPA without systemic change is paperwork. CAPA with systemic change is quality improvement. Organizations achieve excellence when CAPA results is meaningful process improves rather than simply closing records. A deviation investigation should follow a structured approach. Think of yourself as a detective gathering evidence. The first question is, what happened? Establish the complete sequence of events. Identify who was involved, what occurred, where it happened, and when it happened. The second question is, why did it happen? This is often the most challenging part. The investigation must identify the true root cause rather than focusing on symptoms. The third question is, what is the impact? Determine whether the deviation affects product quality, patient safety, batch release decision, or regulatory obligations. A strong investigation is objective, evidence-based, and focused on facts rather than assumptions. One of the most common mistakes in deviation investigations is confusing symptoms with root cause. Not all deviations are the same. Some deviations are even related. Examples include equipment failures, utility interruptions, material defects, environmental issues, or process breakdowns. These require process-level investigations and system improvements. Other deviations are associated with human errors. Examples include slips, lapses, mistakes, incorrect entries, or missed procedural steps. However, it is important to understand that human error is rarely the complete root cause. We must ask why the error occurred. Was the procedure unclear? Was training inadequate? Was the workload excessive? Was the environment discreet? Effective investigations look beyond the individual and examine the entire system. One of the most important lessons in GMP is that retraining is not always the correct CAPA. Organizations often conclude investigations with a simple statement, employee retrained. However, retraining alone may not address the true causes. People are naturally fallible. Errors often result from system weaknesses rather than individual negligence. Investigators should review SOPs and determine whether procedures are clear, current, and practical. They should identify error-prone conditions such as excessive workloads, poor workplace design, distractions, or insufficient supervision. The goal is to strengthen the system through better controls, error-proofing mechanisms, and process improvements. When systems improve, human errors naturally decrease. CAPA stands for corrective and preventive actions. Corrective actions addresses the immediate problem. Preventive actions ensures the problem does not happen again. Personnel related CAPAs mainly include retraining, coaching and counseling, increased supervisions, performance monitoring. Procedural CAPAs may include revising SOPs, clarifying instructions, adding checkpoints, improving review processes, strengthening process controls. The best CAPA programs balance immediate correction with long-term prevention. The focus should always be on eliminating root causes rather than treating symptoms. Root cause analysis is one of the most powerful tools in deviation management. Two commonly used methods are 5 whys. This method involves repeatedly asking why until the underlying cause is identified. For example, why did the sample fail? Because incorrect dilution was used. Why was incorrect dilution used? Because the analyst followed an outdated worksheet. Why was the outdated worksheet available? Because document control failed. The investigation continues until the root cause is identified. Fishbone diagram, also called the SCAPA diagram. This tool categorizes causes into areas such as people, methods, machines, materials, environment. It is especially useful for complex deviations involving multiple contributing factors. Investigators must also differentiate between deviations and internal violations because each requires a different response strategy. The final and most important step is CAPA, effectiveness verification. Many organizations implement CAPA but never verify whether it actually worked. Before closing a CAPA record, three questions should be answered. First, was the action implemented successfully without creating new problems? Second, do trend analysis and quality data show improvement? Recurring issues often indicate that the root cause has not been fully resolved. Third, has recurrences because prevented? Effectiveness review should provide measurable evidences that deviations is unlikely to happen again. Closing a CAPA simply because all forms are signed is not enough. A CAPA is truly successful only when it procedures sustained improvement and strengthens the quality management system. To summarize today's session, we learned that deviations must be documented, investigated, and assessed for impact. We discussed planned and unplanned deviations, structured investigation techniques, root causes analysis methods, human error evaluation, and CAPA design. We also learned that effective CAPA is not only about paperwork, it is about creating lasting improvement that prevent recurrences and protect product quality and patient safety. Remember this message: deviation identified, root cause understood, CAPA implemented, effectiveness verified. This is the foundation of a strong and compliant quality management system. Thank you everyone. If you have any questions, kindly post them in the comment section.